Bismillahir Rahmanir Rahim. Assalamu alaikum everyone, and thank you very much for being here on a Sunday. Thank you very much to PIMA, Pakistan Islamic Medical Association, for inviting me. My talk is on transforming diabetes, power of lifestyle modification, and how often do we talk about lifestyle? I'm grateful to PIMA for actually organizing the Diabetes Symposium and keeping a dedicated talk on lifestyle, because we talk very less about lifestyle, not only in our meetings, but probably also in the clinics as well. So disclosures, I have nothing to disclose. So do we practice what we preach? We tell patients about lifestyle, but do we actually do lifestyle ourselves? So all the audience sitting here, you should not be sitting here for too long. You should relax, get up. So I would request you all to please stand up wherever you are. आप लोग खड़े हो जाएं जहां पे भी आप हैं, please. Thank you very much. जाना नहीं है, सिर्फ खड़े होना है, ठीक है? So I'm just conducting a little exercise. I'll ask you questions, and those who say yes will actually sit down. So do we practice what we preach? So if you have a BMI, body mass index, between 18 and 27, please remain standing. If your body mass index is more than 27, if you are obese, please take your seats. You can sit down if your body mass index is more than 27. मैं देख रहा हूँ सबको, बाद में 27 से ऊपर खड़ा हुआ, so I'll catch you, right? So whoever has a BMI, body mass index of more than 27, please sit down. Okay, अब जो लोग बैठ गए हैं वो दोबारा खड़े नहीं होंगे, ठीक है? अब जो खड़े हो गए हैं वो गेम में हमारे साथ हैं. Next is, if you sleep more than 7 hours every day, more than 7 hours every day if you sleep, please keep standing. If you sleep less than 7 hours, please take your seats and sit down. Thank you very much. जो लोग बैठ गए हैं वो दोबारा खड़े नहीं होंगे, ठीक है? That's, a lot of people have already sit down, right? So okay, अब जो लोग खड़े रह गए हैं वो गेम में हमारे साथ हैं. If you eat 5 fruits, मैंने नहीं कहा, Dr. Saeed told in his presentation, 5 fruits and vegetables every day. If you eat 5 fruits and vegetables every day, keep standing. Otherwise, please take your seats, relax and enjoy on your seats. नहीं बैठ गए तो बैठ जाएं. जो बैठ गए वो पहले ही बैठ गए, वो गेम से आउट हैं, ठीक है? Few people are now standing. We have 2 more questions left, right? If you exercise 30 minutes 5 times per week, keep standing. Otherwise, please again take your seats. जो लोग हफ्ते में 5 दिन आधा घंटा वॉक करते हैं वो खड़े रहें. बाकी लोगों से गुजारिश है कि बैठ जाएं प्लीज. ओके, नहीं, जो बैठ गए वो बैठ चुके हैं, दोबारा खड़े ना हो प्लीज. लास्ट क्वेश्चन, इफ यू डू नॉट स्मोक, please remain standing, otherwise please take your seats. Thank you very much for playing this game. आप लोग अपने इर्द गिर्द देख सकते हैं. Professor Saeed Meher standing here, the few of you just standing here. Give a clap to those who are still standing, please. But you see how difficult it is to actually have a good lifestyle. कितना मुश्किल है. We tell patients, but we realize that even we are unable to do this. 90% से ज्यादा लोग इधर बैठ गए, and that's the power of lifestyle that we are actually missing, right? हम बहुत सारे powers miss करते हैं अपने मुल्क में, और ये power भी miss किया, ठीक है? Okay, so diabetes dynamics, Professor Saeed and I always show these slides. 5th largest world population, Pakistan. Highest diabetes prevalence. 50% of the population is living below the poverty line. Last year inflation rate 23%. इतना cost बढ़ गई है रहने की. Just 2 days back, a woman was crying in my clinic because she couldn't pay her electricity bill. She was crying, and I don't know what to do. मुझे नहीं पता मुझे क्या करना है इस पेशेंट का. 90,000 उनका बिल था कि इलेक्ट्रिक का. कहने का मतलब ये people are suffering from the cost, but then we have something that is easier to do. This is American Diabetes Association, pillars of diabetes management: glucose control, blood pressure management, lipid management, agents of cardiovascular and kidney benefit. But look at the base. What is the base? Lifestyle modification. Most of the times we focus on medicines, patients focus on medicines, we forget what is the base, which is the lifestyle modification, right? And again, if you see the American Association of Clinical Endocrinology principles of diabetes management, look at the number 1 principle. Lifestyle modification underlies all therapies in diabetes. And then this is the American Association of Clinical Endocrinologists algorithm for management of diabetes. They've got 2 algorithms. Complication-centric algorithm. Look at what is at the top, lifestyle intervention. Again, This is another algorithm, glucose-centric algorithm for diabetes management. Look at the top again, lifestyle intervention. It is at the top of all guidelines. But when we focus on diabetes management, do we focus on lifestyle that much? Or do we have a dietitian who's going to do the lifestyle job and the doctor is going to give medicines only and insulin only? And patients, they focus on what the doctors say. They love their doctors. They want doctors to tell them what to do. They don't want to listen to others most of the time. Lifestyle therapy, what is meant by lifestyle therapy in diabetes? And we have not utilized lifestyle therapy much. I remember some 35 years ago when I was a little kid, my grandfather was advising my father and my uncles what business to start. And I remember his sentence when I was a little kid. He was saying, "Khane peene ka business shuru karo, you'll never go in a loss." And I did not understand that at that time. But being an endocrinologist now, my grandfather was a wise man. He knew 30, 40 years ago what's going to come in future, right? And he's correct. In Pakistan, you open a food business, you're never going to lose anything, right? So again, nutrition, physical activity, sleep, behavioral support, and smoking cessation. So in nutrition, of course, calorie restriction if there is obesity or overweight. Then plant-based diet, more high polyunsaturated and monounsaturated fatty acids in the diet. Physical activity, as Dr. Saeed also said, 150 minutes per week, moderate exertion like walking. Sleep is very important. We just don't take sleep so seriously. हम तो सोचते हैं भाई सो जाते हैं तो नींद पे हमने आसान कर दिया कि थोड़ा सो गए. The busy work professionals, right? Sleep, more than 7 hours of sleep is extremely important to control diabetes. Behavioral support, engaging the community in talking about lifestyle, right? And again, smoking cessation, no tobacco products, right? जब भी टोबैको की बात आती है हम कैंसर, लंग कैंसर की बात करते हैं. ये बात नहीं करते कि टोबैको डायबिटीज को कितना इंपैक्ट करती है. Again, ACE recommendations for therapeutic lifestyle changes. Reduce your diabetic patient's weight by just 5 to 10% at least to control HbA1c if the patient is overweight or obese. And studies show that 90% of diabetics, they are overweight or obese, right? Again, physical activity and diet. और मैं इसके बारे में बाद में भी बात करूंगा. A negative energy balance is very important. What you are eating the entire day, are you actually using that? Because you are not using what you are eating, it's going to go into the stock, create obesity and difficult in managing diabetes. Importance of 24-hour physical behaviors. It is so important. हम बहुत सारी चीजों पे focus करते हैं. What the American Diabetes Association says, it's a 5S approach, right? First of all, sitting, breaking up prolonged sitting. So if you're sitting more than 30 minutes, just get up, walk a little bit, maybe just do a stretching exercises and sit down. And that is what I did in the start of my presentation. I helped you breaking that sitting environment that you had, right? Stepping, an increase of only 500 steps per day is associated with 2 to 9% decreased risk of cardiovascular mortality. आप 500 steps extra चलते हैं, 9% cardiovascular disease mortality कम हो जाता है. Just 5 to 6 minutes brisk intensity walk per day. 5-6 minute walk कर लें, brisk walk. The life increases by 4 years, the lifespan. I mean, this is all what research has shown. मैं अपनी तरफ से नहीं बता रहा. Sleep, 7 hours of sleep, more than 7 hours of sleep increases your diabetes control, makes your diabetes control better, reduces your HbA1c. Sweating, more than or equal to 150 minutes of walk every week, again helps you control your metabolic profile. And strengthening exercises like going to a gym, weight trainings, again helps control diabetes. So 5S approach. And what does the 5S approach do? Now look at this. These green arrows are where there is very strong evidence, right? This is American Diabetes Association, just to let you know. Sitting, breaking up prolonged sitting decreases your glucose concentration. Decreases your glucose. Even if you're a normal person, the glucose will go down. If you're diabetic, the glucose will go down. And then stepping. Again, stepping, you reduce your glucose in the blood. Sweating. Now, if you're sweating, you're doing moderate to vigorous activity, 30 minutes of walk every day, 5 days a week, you reduce your glucose concentration, blood pressure, A1C, lipids, physical function goes up, depression goes down, quality of life goes up, just by walking half an hour every day. Now we focus on medicines, we focus on a lot of things. What about physical activity? Again, strengthening exercises reduces blood glucose and A1C. Adequate sleep, just nice 7 hours of sleep every night, again decreases your glucose and your HbA1c. And a good quality sleep, if you have not fought with your wife and if you taken care of her, then again good quality sleep will decrease glucose and blood pressure and HbA1c and lipids as well. I mean, it's such an important thing. You just sleep, do nothing, control your lipids, your blood pressure and your diabetes. So again, exercise and diabetes is a notion that is very old. Everybody knows it. 2001, huge meta-analysis, 12 aerobic training studies, an A1C reduction of 0.66. Another meta-analysis, 2006, 27 studies, A1C reduction of 0.8%. If I ask Professor Meher, what is the A1C reduction with SGLT2 inhibitors? 0.8 to 1%. Exercise is also 0.8%. Free of cost, no charges. In an environment where we have inflation, this is such an easy thing to do. Again, if you see effects of aerobic exercises on A1C in pre-diabetes, even in pre-diabetes, A1C reduces. These are all the studies that shows A1C reduces by around 0.4 to 0.5% in a pre-diabetic if he's doing aerobic exercises. And this is the European Association for the Study of Diabetes, EAST 2020, in the Diabetologia, which is their journal. This is what exercise does. Professor Meher showed us how diabetes works with all the 8 pathologies, right? Look at exercise, how it helps all these pathologies. Look at the beta cell function, which increases with exercise, more insulin production. Look at liver, where there is increased insulin sensitivity, increased glucose uptake. The blood vessels, where there is increased flow and increased delivery of oxygen. The muscles, where there is increased muscle mass, increased insulin sensitivity, increased glucose uptake, better function, muscles get strong, right? Again, the heart, the resting heart rate goes low. Other day I was sitting with a cardiologist who's a heart rate specialist, rhythm specialist, and I asked him, what is the best heart rate to reduce cardiovascular morbidity and mortality? And he said, keep the heart rate between 50 and 60. When we exercise, we improve our heart's function and the basal heart rate goes down. The blood pressure goes down as well. Again, for the fat cells, it decreases the adipose tissue depots, increases insulin sensitivity and increased glucose uptake. And overall, what is the impact on health? Now, this is evidence-based in the European Society, European Association of Study of Diabetes. Look at on the far right, decreased insulin resistance, decrease in type 2 diabetes incidence, decrease in the MASL, which is the liver disease, the fatty liver disease, decreased cardiovascular disease, reducing the metabolic syndrome, reducing the obesity, and reducing the mortality. What else we want in a diabetic patient? What we want with diabetes? We want reduced complications, reduce the morbidity, reduce the mortality. So why not lifestyle first? And why not lifestyle with a vigor and with an energy, right? Again, 150 minutes is the magic number. You have to do 150 minutes every week. Now, whether you do 50 minutes thrice a week or 30 minutes 5 times a week, or you break it. Studies say that if you can't do 30 minutes in one go, people say, doctor, we can't take out time. Take out 7 minutes 5 times a day and do it. Complete that 30 minutes. Remember, 7 minutes of brisk walking increases your lifespan by 4 years, the study says. So, do that 30-minute walk. हम सोच में पड़ जाते 30 मिनट कहां से निकालेंगे, टाइम ही नहीं है, इतने बिजी है, तो 5-7 मिनट निकालते चले जाएं दिन में 3-4 बार. Again, what is the METs, metabolic equivalent? So when somebody is at rest, we consume 1 metabolic energy, right? For example, then slow walking consumes 3 METs, walking upstairs 4.7 METs, brisk walking 5.4 METs, bicycling 7 METs, running 8, hockey 12, and boxing 13. But we can easily do brisk walking and increase the metabolic rate of our body by 5.4 times for the resting rate and increase the oxygen consumption and calories that we have. You are what you eat. I mean, we have got so many hadiths saying we are what we eat. So many hadiths are linked to what we eat actually makes us. Evidence-based European recommendation for the dietary management of diabetes. Now just see this. European recommendation, again last year, Diabetologia. Important messages are to consume minimally processed plant foods such as whole grains, vegetables, whole fruits, legumes, nuts, seeds, and non-hydrogenated, non-tropical vegetable oils while minimizing the consumption of red and processed meats, sodium, and sugar beverages. I mean, we all know this. It's very simple. If we don't go into the nitty-gritties, it's pretty simple. We need to avoid sugary items and meat and processed food. The diabetic plate, it's very important that we understand it cannot be a plate of rice only. It cannot be a plate of bread only. It has to be divided. There has to be vegetables, fruits, grains, proteins, and dairy. And low-fat dairy, of course. Low-fat protein. It has to be a mix of diet. Remember, we don't eat because we only love it. This is God's beauty that is given. He has given us love to eat so that we actually eat. A car runs on petrol. A human runs on food. We have to take food to have energy. लोग कहते हैं carbs को बिल्कुल low कर दो जैसे keto diet में होता है. We need carbs. Our brain need carbs, right? It's difficult. It's the other thing that we need. 45% carbs are needed in a diabetic person, but it has to be complex carbs with reduced rate of absorption. The Mediterranean diet again, this has been shown to be for now the best diabetes diet that you can have. Look at the lower end of the pyramid. More whole grains, bread, beans, legumes, nuts and seeds, fruits and vegetables, and then olive oil, fish. And as you move to the top, little of sweets and meat. Okay? So this is what we need to understand. Now, we all go through this every day, but it becomes a challenge. Now, I had to go to a birthday of my Sala's daughter, and there was cold drink, and there was cake. And when I refused, I don't want to eat cake, my wife said, "ये साली ने आपकी बनाया है." अब वो एक अलग मसला कि आप मना करेंगे तो भी फंस जाएंगे. In our society, it's very difficult to say no in these things. People mind it. आप मेरे घर आएंगे, मैं कहूँगा ये तो लेना पड़ेगा, वरना तौहीन समझी जाएगी. भाई डॉक्टर साहब ने ऑफर किया, गुलाब जामुन रख दिया, आप घर गए थे और नहीं खाया, पानी पी के आ गए. In our society, it's very difficult to control diet, but we have to change things being healthcare professionals, right? Again, look at the effect of Mediterranean diet on mortality. Many studies showed that regardless of what it's diabetes or no diabetes, Mediterranean diet reduces mortality and cardiovascular mortality. Whether you are a smoker or a non-smoker, it helps. And again, there is a lot of discussion. Which diet to take? Should we take a Mediterranean diet? Or should we take a low-fat diet? Whatever diet you take will reduce weight, but it has to be consistency. आप लोगों में से कितने लोगों ने सुना है चीट डे? चीट डे कितनों ने सुना है? मैं तो पढ़ता रहा, मुझे तो चीट डे नहीं मिलता. हमारे यहाँ चीट डे, हमारे यहाँ हर चीज चीट पे, बस चीट डे. What is a cheat day? ठीक है? So many guidelines will suggest it has to be a consistent diet. Just carry on with the diet every day. आप 6 दिन मेहनत करके 7 दिन आप सब कुछ खा के तबाह कर दें, बर्बाद कर दें, ठीक है? That's not how you go about it. It has to be a consistent diet. Intermittent fasting and the beauty of the month of Ramadan, and there are many hikmat in the roza that Allah has made obligatory upon us, but intermittent fasting, there are so much data on intermittent fasting. For example, studies show that if you have a 10-hour time restricted eating and you don't take anything for the next 14 hours, you start to lose weight. You start to control diabetes and blood pressure and cholesterol, even with the normal diet that you are taking, right? Time restricted eating or intermittent fasting. लेकिन हमारे यहाँ क्या होता है रमजान में? हम पूरा दिन रोजा रखे हुए, हमारी इफ्तार होती है, उस पे स्टडीज होती हैं, and there are mixed studies. People have lost weight, people have gained weight in Ramadan, ठीक है? ऐसे भी लोग आते हैं जिनका रमजान में वेट बढ़ जाता है. प्रोफेसर इस्लाम would agree, would probably second कि रमजान के बाद कितने लोगों का A1C बढ़ जाता है, ठीक है? वो इफ्तारियां ऐसी होती हैं और इस पे डिटेल टाइम नहीं है, वरना मैं मजीद भी बात करता. So again, the same slide that Professor Said showed, we need to shun this dark, brown, uncolored diet. हमारी conferences में भी तो ऐसी diet होती है. And I remember once there was a conference जिसमें शोर हो गया. वही record नहीं कर लेना इसको, ठीक है? Conference में healthy diet थी और वहाँ it became a problem. There was resistance on part of health professionals कि भाई ये क्या खाने में रख दिया हमारे लिए, ठीक है? So it is a difficult task to change lifestyle, but we have to start from one point and start doing it then. This is the colorful diet that we need to be having. So now the time is for type 2 diabetes remission. This is something that has given a lot of hope to us, a lot of hope to patients. So again, in patients with type 2 diabetes and obesity, weight loss of around 15 kilograms can lead to a remission of type 2 diabetes in 80% people. And studies have clearly shown that as weight goes up, the chances of diabetes goes high. As weight goes low, the chances that diabetes will come in goes low. And look at this. This is the weight gain that you have. If a diabetic has 5 to 10% weight loss, remission chance is around 30%. And if a diabetic person who's overweight or obese loses 15 kilograms of weight, there is 80% chance that he will go into remission of diabetes. But this is just remission. लोग कहते बस हो गया डॉक्टर साहब, अब खाएं पिएं. It has to be a consistent diet. मैंने नमाज 5 बार पढ़नी है तो 5 ही पढ़नी है कि इंशाल्लाह आखिर तक. तो कहने, the whole point it has to be consistent. We can't lose the pot, right? Again, quit smoking. Now smoking is injurious to health. और वो डब्बे पे इतना बड़ा कैंसर का लोगो आ गया है और हमारी प्रायोरिटी ये है कि इतना साइज होना चाहिए उसका, ये कैंसर वाले मुंह का. लोग तो नहीं रुके स्मोकिंग से, ठीक है. We have to mobilize people. I always say, जब हम मीडिया खोले तो वही पॉलिटिक्स. क्यों हम मीडिया नहीं खोलते हैं तो ये बातें नहीं होती हमारे सामने. We can change things. I mean, we can make our own channels to propagate these things. 30 to 40% increased risk of diabetes with smokers. And the more you smoke, the more the chances of getting diabetes. And same goes with diabetic people. You quit smoking, you reduce your smoking, and you control your HbA1c. You don't need to come back to us again and again to control A1c then. Plain water intake. Water, pani mein shifa hai, hum sunte. The latest study, 2024, says plain water intake prevents diabetes mellitus. I mean, the more water you take, through a lot of molecular mechanisms, they have seen that in normal people who don't have diabetes, the blood glucose levels significantly drop only by taking a certain 8 to 10 glasses of water per day. This was 3 liters per day in this study. Such an important aspect, water. But we say कि प्यास लगेगी तो हम पिएंगे, ठीक है? So water has healing powers, right? Why miss these powers? Sleep. 250,000 participants, this is a British registry, and though they saw that individuals sleeping less than 6 hours daily had a notably higher risk of developing diabetes compared to those having 7 to 8 hours of sleep per day. Such an important component. सोने में जब हम कुछ नहीं कर रहे होते हैं, उसमें भी हिकमत ही हिकमत पोशीदा है, ठीक है? Thank you very much. I think it's time that we start working on lifestyle management. Thank you very much.